Hi, I'm Dr. Emily Johnson here for part 3 of our ways to optimize your healing after your surgical procedure. In the first episode, we were talking about what you can do leading up to your procedure to optimize your health. In part 2, we talked about how you can absolutely ruin your results by doing certain activities or certain things too soon or just at all in your post-op period. And today I'm going to talk about ways you can speed up your healing. So first off, let's talk about supplements like arnica and bromelain. Those will help decrease the bruising and swelling in that immediate post-op period. I also really personally like to use and recommend arnica gel, especially in those stubborn areas for bruising, like underneath the eye or in that previous jowl region, or even the swelling in the submentum. Another thing that I also recommend in the post-op period would be a set of 3 CO2 lift masks, usually stacked in that first post-op week. What that does is it creates more or less a hyperbaric oxygen treatment in the form of a jelly mask. The mask delivers a lot of CO2 to your skin. Your body then responds by flooding the area with oxygen-rich blood, and that oxygen is desperately needed in order for cellular turnover, cellular repair of any damage to that post-op site. If you can tolerate an actual hyperbaric oxygen chamber treatment, you can also do those. Again, recommended at least in a series of 3, sometimes more. Next, let's talk about diet. I love to recommend a diet that's rich in protein, specifically, and at the very least, 60 to 80 grams per day, and more if you can tolerate it, depending on your gut. I also like a low processed food diet that will be low inflammatory, as well as increasing our healthy fats in our diet. That's going to be key to getting the nutrients that you need in that post-op period. Other things that you may have heard before are LED light treatments. Red light is really good, again, at delivering oxygen to the area. Yellow light is good for decreasing bruising and swelling specifically. And I know that I harp on this a lot about being too active in the post-op period, but being too stagnant can also make that bruising and swelling kind of linger a little bit longer. We want that lymphatic system to get up and returning to its normal function. So I want my patients actually to be getting up, getting their own snacks, water, etc. that first day or two. By the end of day 3, they can walk to the end of the block. And by the end of the first week, they can gently, without increasing their heart rate over 120, they can walk up to a mile. And then lastly, for certain patients, I will recommend lymphatic massage after the first couple of weeks after surgery. Not for every patient, but it can help with some of that more stubborn swelling after your procedure. If you're having surgery in the next few weeks or months, or if you know someone who is, and this list will help you with that, save that for yourself or share it with your friends. Let's make sure that we get you back to your normal, full functioning and active self as soon as possible.